Hi, everyone. Hope you all are having a wonderful weekend. Welcome to episode 5 of our pregnancy web series. I'm Deepika Rao, admin head at RaoHospital. And I think so far we have covered very important topics like preconception healthcare and tips, and pregnancy guide for first trimester, second trimester, and third trimester, where expert doctors have spoken about symptoms that the mother might experience, growth and development of the fetus, um, pregnancy do's and don'ts, and other important points. And we've actually got some wonderful feedback from our viewers, and really thank you so much for that. I think that's what makes us that's what gets our content going from our doctors, and we spend so much time preparing for this. So thank you for the feedback. It really motivates us. And so let's move on to today's session. It's going to be on busting pregnancy myths. And joining us is Dr. Damodar Rao. He is a senior consultant gynec endoscopy and fertility at RaoHospital and Care. Over to you, doctor.
Thank you, Deepika. So hi guys, we're back as usual at 4 p.m. every Saturday. So this session is going to be about busting the myths, myths surrounding pregnancy. So there's a lot of assumptions and myths surrounding pregnancy. A lot of people tell you stuff hoping that it will probably help you, but many times they might tell you something and you may not like it either. It might upset you and it might even misguide you and unnecessarily cause stress. So we at RaoHospital are here to debunk all the myths surrounding pregnancy and guide you step by step toward your pregnancy. So I think we'll start by taking the questions.
And also like to mention that Google is not your best friend. To all you mothers out there, if you have any doubts, please do consult your doctor or come to us, consult our experts at the hospital, and we'll be more than willing to give you advice on all your doubts. So do not go to Google for any advice on all these myths. So let's start with the first myth. Pregnant women need to eat twice as much.
Pregnant women, yeah. So that's completely a myth. It's not true. Your body, basically the placenta will decide, it will take all the nutrition that is required from the baby from what you eat. You just need to add another 200 calories to your regular diet. So it's not like because you have one more person or a human being growing inside you, you have to eat for 2 people. That's completely wrong. If you do that, you'll end up putting on a lot of weight. Usually at the beginning of pregnancy, your obstetrician will tell you as to how much of weight you can gain. Ideally, it's anywhere between 9 to 12 kilos. And based on your body mass index, it might even go on to 15 to 16 kilos. So it's not true that you should eat for 2 people. Eat what your obstetrician tells you and eat a healthy, balanced diet. That's all that is required.
Right. So let's move on to our second myth. Your belly can reveal the baby's gender. A low belly means boy, a high belly means girl.
Yeah, okay. You probably hear this from a lot of your friends who, they probably want to sound wise and tell you things like you're going to have a boy or you're going to have a girl. There is no truth to this at all. If they see you early on in pregnancy, usually early in pregnancy, you have a low belly because of gravity, the baby and the uterus is lower down. So it's only the lower part of your uterus that becomes more prominent. But as pregnancy advances, you have a high or rather a full belly because the baby then occupies the whole of your abdomen. The uterus occupies the whole of your abdomen. So I think based on which trimester of pregnancy they see you, they're going to say, oh, you have a high belly, or you have a low belly, and oh, you're going to have a girl, you're going to have a boy. None of this is true. Yeah.
Right. So moving on to a third myth, they say if you suffer from severe heartburn, excess nausea, and vomiting during pregnancy, your baby is likely to be born with a head full of hair.
Yeah, this is also something you hear commonly that, or you have a lot of nausea and vomiting and your baby is going to have head full of hair. I have a friend who's completely bald right now, and apparently his mom threw up a lot during pregnancy. So there is, there's no connection at all. So mainly the anything like a heartburn or anything is caused because of the hormone called progesterone, which actually there is a valve between your food pipe and the stomach, and that becomes a little lax during pregnancy. So whatever food you eat tends to regurgitate into your food pipe quite often. And that's why you get the heartburn or sometimes nausea and vomiting. Yeah.
Thank you for that. Moving on to our myth number 4, induction always leads to cesarean.
Yeah, that's also another common myth. Definitely not. See, it's not that inductions lead to cesareans. It's that, number one, we induce a patient because of some reason, right? Maybe the patient has diabetes, or maybe the patient, when it's uncontrolled diabetes, uncontrolled hypertension, or you have some other medical problem where, or growth restriction, where we feel that if the baby is inside the stomach for any longer, it could be detrimental to the health of the baby. That's when you induce. So already the pregnancy is a little complicated. And the main indication for a cesarean in such cases, or any cases when there is distress to the baby during labor, if the heartbeat of the baby goes down, then we might decide for a cesarean. So usually this is already a complicated pregnancy, and it is for some other reason that we do a cesarean. It's not because we've induced labor that she will definitely go in for a cesarean. It's very, very programmed nowadays, the dosage of the medicines and everything. Most of the inductions do go in for a normal delivery, almost as high as 80%.
Right. So moving on to our myth number 4, applying essential oils and other oils on the tummy can prevent stretch marks.
Yeah. Again, coming to stretch marks, there's no real magic lotion that's going to take away your stretch marks. What you can do to reduce stretch marks is, again, eat right so that you don't put on too much of weight during pregnancy. Your body can only stretch that much. So, or your elasticity of your skin is only that much. If you put on more than the required amount of weight, then there is a higher chance of getting more stretch marks. Yes, you will get a little bit of stretch marks, but then to avoid more stretch marks, don't put on too much of weight during pregnancy. Of course, you can apply oils, definitely. This will reduce the itching that surrounds these stretch marks. So stretch marks can't be prevented, but you can reduce them.
Okay, so myth number 6 is what you eat during your pregnancy can affect or influence the baby's palate after it's born.
Yeah, that's not true at all. Again, what you eat during pregnancy is not going to affect the baby's palate at all. So you can completely eat whatever you want, as long as it's not you're not having gestational diabetes or pregnancy-induced hypertension or some other medical condition. You can eat whatever you want. It's like you could compare the food going to your baby as to you having an IV drip, right? When you get an IV drip, it's giving you nutrition, but it's not going to change the taste in your mouth or anything like that. So yeah, it's not going to affect a baby's palate at all.
Okay, so myth number 7 is pregnant women shouldn't consume caffeine.
Yeah, coming to coffee is again a tricky one. Well, anything in excess is not good, right? Especially in the first trimester. They say stay away from coffee mainly because it can induce a lot of nausea. You're already, having nausea and heartburn. The heartburn can become a lot worse with coffee. Coffee basically causes a lot of acidity. So during the first trimester, it's better to avoid it if you have a lot of heartburn and nausea and vomiting. But second and third trimester, a cup of coffee a day is absolutely fine, as long as it. In pregnancy, most of the times, most of the women will have heartburn. So coffee will aggravate that. That's one reason why we say, to stay away from coffee. But 1 cup of coffee a day shouldn't really, affect your pregnancy.
Right. So myth number 8, I think, is pretty similar to myth number 7. Can I have a glass of wine when I'm pregnant?
Again, alcohol is generally a big no during pregnancy, especially during the first trimester. First trimester, the baby's organs are developing, and all the small parts of the baby is developing: the heart, the lungs, liver, kidneys. So you want to, take the best care you can. So alcohol is a big no during the first trimester, but I don't know, if you're at a party and everybody's drinking, maybe you can just have a sip or two during the second and third trimester. Otherwise, on the whole, from the medical fraternity, we generally say avoid alcohol during pregnancy.
Okay, so myth number 8 is pregnant women should avoid exercise at all costs.
Okay, again, exercise during pregnancy, you should not avoid it at all. Again, there is no, one prescription for all women. Depending if your pregnancy is going on fine, if the length of your cervix is all right, if you do not have pregnancy-induced hypertension or no other medical conditions, then you can definitely exercise during pregnancy. It is in fact recommended. A good walk is very important. That way you will even prevent, probably gestational diabetes to kick in. So there is a recommended, generally we say that, let your heart rate not go above 140 or 150 while you're exercising. So you should, or even 160. So there are certain exercises which you can do. And yes, it's definitely beneficial in pregnancy, in fact.
Okay, so moving on to our 10th myth, pregnant women shouldn't travel by flight.
Okay, coming to pregnancy and traveling, especially by flight, it's not that you shouldn't travel by flight. There are no such rules. As an industry, the airlines don't let you, the aviation industry doesn't let you fly beyond 32 weeks. So, because in case you get into labor in the flight and, such complications they want to avoid. That's one reason. But if you look at it medically, one problem we're all worried about is clot forming in your veins of your legs. It's called DVT, deep vein thrombosis, is what we're worried about. Pregnancy is a condition where, there's more chance of clot forming in any part of your body. And if you're immobile for too long, that's when you're predisposed to clot forming, and even high altitudes and dehydration. So avoid all this. If you're flying, at least, walk in the flight every 1 hour, hydrate well. These are very important things to do if you're on a long flight. If you're on a short flight, I don't think you really have to be worried about anything much.
Okay, so myth number 11 is you cannot get pregnant while you're breastfeeding.
Okay. Well, the general rule is that you most of the times won't get pregnant when you're breastfeeding because your hormones are still on the higher side, and you won't ovulate basically if you're breastfeeding. But by breastfeeding, what they mean is if you're feeding well, if you're feeding frequently and you have good milk secretion, all these should be there. And only then, you won't become pregnant. But in case the frequency of your feeds reduce or your milk secretion reduces, then you have to be careful. You have to use some kind of protection. So there is a small chance that you can become pregnant while you're feeding.
Okay, so myth number 12 is sex during pregnancy can harm the baby.
Sex during pregnancy, again, this is a commonly asked question. During the first trimester, we say it's kind of avoidable because, again, the pregnancy is settling in. The parts of the baby are developing. And usually after 12 weeks, we generally say the pregnancy is better settled. So during the second and third trimester, it's absolutely all right. There are a lot of articles talking about, if the semen is in the vagina, there could be prostaglandins in the semen, which can initiate labor and things like that. It won't happen early on in pregnancy. It only in later stages of pregnancy, when the uterus is more receptive to prostaglandins, then maybe it can augment labor at that time, or it can initiate labor at that point. So it's absolutely fine.
Okay. So myth number 13 is sleeping or taking a nap on my back can be harmful for the baby.
So regarding sleeping on your back, couple of things. One is all the major blood supply to the uterus, the blood vessels run, at the rear part of your body in the midline. So we say if you lie on your back, it can compress those vessels, and hence the blood flow through the uterus can reduce a bit. So it's always advisable that you sleep on your side. Sleeping on your side is also beneficial in terms of, it relieves you a lot of pain. Lying on your back, you can get a lot of back pain or, upper abdominal pain. So lying on your left lateral is the best. But if you don't, you can lie on your right lateral too. You can keep shifting positions, or you can even sleep on your back for a bit. So the best thing would be to lie on your left lateral. Second would be right lateral. And if you're tired doing both, then you can even sleep on your back for a bit.
Okay. Myth number 14 is eating spicy food and having sex can induce labor.
Again, about sex and about the semen produced, sex per se can't induce labor. The semen can contain certain chemicals called prostaglandins, which prostaglandins do, can induce labor, but this is, it happens only later on in pregnancy, and it's not a completely proven theory, really. The other question was about spicy food. No, again, if you're somebody who's been used to eating spicy food, or if you just had spicy food, there is absolutely no correlation between the kind of food you eat and about induction of labor. They're two different systems completely. So don't really worry about what kind of food you eat. But spicy food is generally avoided mainly because of heartburn, nausea, vomiting, and things like that. So yeah, if you can tolerate it, please go ahead.
So the next myth is again about the gender of the baby. I think a lot of myths are surrounded around this, about certain things can relieve the sex of the baby. It's a boy, it's a girl. So myth number 15 is gender revealing myth is craving for salty food means you're having a boy. Craving for sweet food indicate you're expecting a girl.
I'm hearing this one for the first time, but yeah, there are various myths surrounding determining the sex of the baby. People are trying to sound knowledgeable and tell you all these things. There is absolutely no way that you can find out the sex of the baby except if you do a scan, or there are certain blood tests in which you study the chromosomes and things like that. But these are not allowed in India. So in India, till the baby is delivered, definitely there's no way of identifying the sex of the baby.
Yeah. So moving on to our 16th myth, daily intake of saffron during pregnancy makes the baby fair. This is a common one. I think most of our doctors hear.
We get this quite often. I don't know, there's people who want all the babies to be fair. People are still running after fair skin in India, but there is no truth to this at all. Saffron probably is an antioxidant and anti-inflammatory. So in small quantities, if you have it with milk, it's all right. But it's for this purpose, particular question that you'd ask me, no, there is no connection at all. There is no medicine or no food ingredient in the world that can determine or change the color of your baby. It's, it's something that's determined genetically, basically.
Yeah, it's all in the genes. So myth number 17 is during pregnancy, the mother always develops a perfect facial or pregnancy glow, as they say.
Well, let's just put it this way, that compared to the first trimester, the second trimester is usually the trimester when you look much better compared to your first trimester. First trimester, you're probably tired all the time, throwing up, losing weight. So compared to the first trimester, I think the second trimester, the women look healthier, and that's when you say you have your pregnancy glow. But at the same time, it's, I don't know, when you call it a glow, some people could have a little, more of hair growth, which is not pleasant, or some people could have hyperpigmentation. Generally, the areas of your skin which are already a little dark tend to become a little darker. There is hyperpigmentation that happens during pregnancy. So these are the changes that happen during the second and third trimester, which are absolutely normal, and they go away with pregnancy.
Right. And moving on to myth number 18. I think this is another fairly common one that most of our doctors hear. Consuming ghee during your pregnancy will facilitate a smooth and quick delivery.
Yeah, this is a big myth again. Maybe ghee was used back in the day because it was a good source of nutrition in case your general, if you're a little malnourished or not eating well. But there are some people who think that eating ghee is, it's going to help your pregnancy a lot. It's going to aid your digestion. It's going to relieve your constipation. It's going to make your delivery a lot smoother. Maybe they think the baby will just slip out because ghee is a lubricant. But none of this is true. There is absolutely no correlation between eating ghee and an improved pregnancy outcome as such. It's as good as a nutrient than anything that's out there. But if you're already eating well, then I don't think you should have ghee every day because it is fattening. So take it once in a while, maybe with some food that you like or something that goes along well with, but I wouldn't recommend it as something that you have every day.
Right. So just quickly, we've got a few more myths to bust. Before that, if you have any queries, any more myths you'd like us to discuss, please do leave a comment down in the comment section. Moving on to our 19th myth. If you are happy and think positive, the baby will grow better.
Well, this is, you could say, is sort of true, because the way you think, and if you think positively and you're happy and good mood, the hormones released in your baby inside in your body are also nice hormones. There are no stress hormones released. If you're upset or angry, there will be stress hormones that are released in the body, which is not good for your baby. So it's always good to stay positive, think positive, and all good things will happen to your baby.
Right. And the last myth, myth number 20, is family will insist on keeping a big secret about the pregnancy in the first trimester to safeguard the mother and child from evil eye and not allow a miscarriage to happen.
Well, this probably the reason why they say that don't talk about your pregnancy in the first trimester or the first 3 months is because your pregnancy is like settling in. There is a high chance that somebody, not high chance, but there is a decent chance that somebody could have an abortion. A lot of people who become pregnant for the first time might have a spontaneous abortion. And this is why you don't talk about it. When you become pregnant, you don't talk about it openly for the first 3 months, because you talk about it and then people ask you how your pregnancy is going and things like that. And then if you lose your pregnancy and people are talking to you about it, it kind of adds to the stress. So it depends on your personality totally. If you're somebody who likes to talk about your problems and comfortable doing that, is absolutely fine. But if it's going to aggravate it, if you've lost the pregnancy and then if people are asking you about it all the time, it's just going to add to the stress. So there's nothing like evil eye, during the first trimester, but this is the time that pregnancy is settling in. It could, most of the times pregnancies do well, but sometimes they don't. So that's why you're asked not to talk about your pregnancy in the first 3 months.
Right. So let's move on to a couple of questions that have come in our chat box. So morning sickness is only in the morning, and is it only in the first trimester?
Well, yeah, morning sickness is a misnomer per se. Uh, yes, most commonly it's in the morning, but people could have nausea and vomiting in the afternoon. Some people could have nausea and vomiting only at night. So, but most of the times it's in the morning, and hence it's called morning sickness. Sorry, what was the second part of the question?
Does it happen only in the first trimester?
Yeah. So again, it's more common in the first trimester. And why we have nausea and vomiting is mainly because of, I don't know if we discussed this about if your child has a lot of hair.
Yeah, we did cover that myth.
So it's nothing to do with how your baby is. It's generally, nausea and vomiting is mainly produced because of this hormone called beta HCG. So beta HCG is responsible for the amount of nausea and vomiting you have. Some women have more of beta HCG. Some women have less of beta HCG. There is another scientifically proven study that says that if you take your pre-pregnancy vitamins for more than 3 months, if you take your folic acid for more than 3 months, then there is a chance that your nausea and vomiting during pregnancy will be slightly less versus if you've taken it only for a month or two. And it's predominantly genetic. If it runs in your family, if your mom had it, then there's a higher chance that you're also going to have it.
Yeah. So moving on to another question. Is it true that stress can affect conception?
Yes, I mean, stress is very, very vital. It plays a big role. Mind over matter. It's huge. So people who are trying to conceive, try and be less stressed. I don't know if it's at work or at home or it's with your partner, whatever it is. Definitely stress has a big role to play. And also don't be, when you're trying every month, don't be very keen that you should become pregnant, every time you try. It doesn't happen all the time. The chances that a couple can conceive when they're having timed intercourse, as we say, that is when you have intercourse during your time of your ovulation, is only about 50 to 60%. So it's not like it's only in the movies that you see that people have sex for the first time and then they're pregnant. So it will happen eventually. Don't stress about it. Stress does play a huge role. So yeah.
Yeah, moving on to our next question is again on gender. It is, I read that the heart rate of a fetus can also predict the gender. Is it true?
No, there's really no correlation between heart rate and gender again. No. Yeah.
Okay. Next question is, does spinal anesthesia or epidural cause back pain?
Okay, this is a good question. A lot of people do ask me that, and a lot of people favoring or wanting painless labor nowadays. So during this process, yes, you are given an epidural analgesia. That is a small needle goes into your back, and then the medicine is pushed into your back, and then you feel numb in your legs. Back in the day, maybe about 15 years back, the needles were slightly thicker. But now with the improvement in technology, the needles are become really, really fine, and you don't feel even the needle prick at all. So no, it does not cause back pain. Back in the day, it used to, yes.
Okay, so our next question is, can I take head bath when planning for pregnancy? If I missed my period before confirming the conception, my mom usually won't allow me to take head bath 10 days before my period date.
No, there is no correlation between between the head bath and your period date. Please do continue to have a head bath. I think it's gonna, your partner stay closer to you that way, I think.
Yeah. Thank you, Mr. Suresh Babu. I hope you're enjoying the session. Thank you for joining us. Next question is, how will my TSH level affect my baby during pregnancy?
Yeah, your thyroid levels are very important. We always want the thyroid levels to be under control, especially during the first trimester. We want it to be within 2.5. There are certain, it can affect your baby in certain ways. So taking a thyroid medication is very important. Doing a thyroid test in the first trimester, if you've never got it done, is very important. And accordingly, if it is elevated, your doctor will give you medicines to keep it under check. So thyroid is very important hormone in pregnancy. Thyroid stimulating hormone, TSH.
Okay, so the last question for today, and then we'll probably just wrap it up, is mood swings and stress common in first trimester?
Yes, during pregnancy, the hormones are on the higher side, and especially in the first trimester, your body is adapting. You feel tired, you have heartburn, you have nausea, you have vomiting, you're not gaining weight, you're not feeling the best, and something is growing inside you, a lot of changes to your body. So yes, you can have a little bit of, mood swings, and you could be stressed a little more. So yeah, it's partly true. Yes.
So I think that's what all the pregnancy myths that we've covered today, and I hope you'll have enjoyed today's session as much as we have. And if you do have any more questions regarding your pregnancy or regarding any myths that you heard or superstitions that you heard during your pregnancy and you want to get your facts right, please do message us, or you can drop a mail to our email ID or even give us a call. Come down to our clinic and meet our doctors as well. So that's all for today's session. And I think Dr. Damodar would like to add something.
Yeah, I just would like to, we are having a surgical workshop the next week, and as a part of our CSR activity. So if any of you have deserving patients who cannot afford surgery for any problems related to the uterus, if it's infertility or whether they have heavy bleeding or pain, or they want to get the uterus out, or they want to get fibroid out, please send them over to our clinic. We're doing it at highly subsidized rates. They just have to pay for the medicine, nothing else. The surgery is free, the anesthesia is free. So yeah, those who are needy, those who really need a surgery and can't afford it, please ask them to drop by. Thank you.
Yeah. And last time we had a few people messaging us asking where can we watch the video. So for those of you who have missed today's session or any of our previous videos, our videos are all on our Facebook page, and they will also be uploaded to our YouTube page. So please do like our videos and share them and subscribe to our channel. Follow us on all our social media, Instagram, Facebook, so that you're updated on our posts. And do join us for our next session next Saturday at 4 p.m. on labor and delivery preparation by our doctor. Thank you.
Yeah, thank you. Thank you, everybody. Thank you for joining in.